Hello, I'm Debara Tucci. I'm an otolaryngologist here at Duke University Medical Center. I specialize in care of people with ear and hearing disorders and disorders of the balance system. Before I went to medical school, I was an audiologist, and an audiologist is someone who diagnoses hearing disorders from the standpoint of measuring the hearing. I was working in a department of otolaryngology, actually at the University of Virginia. It became apparent to me that there was a lot that you could do as a physician that you couldn't necessarily do as an audiologist. So decided to pursue medical school to be an otologist or a neurotologist. I think that the reason you come to Duke is because we all subspecialize, and we work with colleagues who can help out if there's a problem that a patient has that is really not something that we do on a day-to-day basis. But all I do is take care of people with hearing imbalance disorders and tumors related to hearing and the balance organs. So I think that you really get a very high level of expertise when you come here. My philosophy of patient care is that I try and get to know the patient and learn what their concerns are. And I don't have a paternalistic style of practice. I think very open to what the patient wants. So some patients, when they learn a diagnosis and we talk about potential treatments, they're very interested in a definitive treatment. Other patients are more interested in learning as much as they can and then making their own decision. And so I try to adapt what information I give the patient to their desires. I love the field of cochlear implantation. I really love talking to my patients who were without hearing and then they got their cochlear implant and now they can hear again, and they talk about being able to hear sounds that they haven't heard for years, like the bird singing or the toilet flushing. So it's very, very rewarding.